So next, continuing with musculoskeletal system. So I would like to say these all things are readable points. Okay, very easy points. All the functions will be reducing, so problems will be due to that. So in musculoskeletal system, we can see decreased density of bone and gradual loss of the bone mass. So it can start around the age 30. So bone resorption will be more than bone formation. Decreased water content in the cartilage. Hence, the cartilage mainly present in the joints, right? So the joint will be having issues. So in aging, the increased parathyroid hormone, the decreased vitamin D and calcitonin also play in role of this bone, because decrease bone. So in women, there will be deficiency in estrogen, malabsorption in calcium, as well as lifestyle factors also will leads to calcium deficiency, because old age they are not interested to take extra drugs. Already they will be having many drugs. So instead, in that cases, they will not be taking much drugs. So intake of multivitamins as well as other vitamins will be less. So all these things can contribute to bone loss. So aging brings decline in numbers of muscles, resulting in reduced muscle mass. So that is sarcopenia, loss of muscle. So when sarcopenia is there, the person will be feeling very fatigued, and there is no much support while walking. So there is chance of fall as well as fracture. So muscle strength also reduces, especially due to lack of exercise. As we get old, we limit our activities. We are scared to move. We are very much fatigued to do any activity, etc. So decrease in muscle tone, decreased amount of elastic tissues, and slower muscle response. So these all things can be seen along with elasticity of tendon and ligaments will be decreasing. The range of motion will be decreasing, leading to stiffness. The joint mobility is decreasing, leading to decreased flexibility. Osteoporosis is commonly seen in adults. Elders, not elders, sorry, old age peoples, but more commonly seen in females. So thinning and softening of bone. Osteoporosis, pore formation in the bone. So other than that, enhanced or exaggerated bony prominences in the joints mainly. You might be noticed when the person get older, this height will decrease. So height is decreasing due to the spine problems. So intervertebral space will be reducing due to narrowing of the spaces in between. That is one of the common causes telling that water loss. The synovial fluid will become reducing or will become more viscous. That contributes to the shortening of the height. So that is all about musculoskeletal. Now coming to the genitourinary system. So the first one, bladder. So bladder size and tone will get decreased. So what will decrease? The capacity also will decrease. So incomplete bladder emptying. The person will feel that the bladder is not emptying, and it is true that it will not get emptying. So that may be due to neuronal response, decreased neuronal responses. So chronic urine retention from weakness as well as bladder muscle. So increased ease of backflow of urine. Sometimes backflow of urine is a common problem which is faced in male old age. So muscular uterus, urethra as well as bladder lose the tone and elasticity. As we told, the capacity of the bladder will be reduced. So it will reduce from 500 to 600 to 250 ml. So increased residual urine frequency and nocturia also has been seen. Increased incidence of UTI, increased plasma urea and uric acid. So all these things can be increased. Plasma urea and uric acid is commonly increased due to the kidney problem. So kidney filtering as well as glomerular filtration rate will be decreasing. That's why increased plasma urine and uric acid. And Delayed sensation to void. In men, BPH is associated with aging, leads to urinary incontinence. So BPH is one of the most common problem which can be seen in men, old age. So there will be weakness in over the pelvic muscle, and again it leads to incontinence, stress incontinence. In men, there will be increased prostate size. That is commonly related to benign prostate hyperplasia. And regarding the kidney, the size of the kidney will be reduced 20 to 30% by the age of 90, as well as the function was and output also will be reduced. Decreased glomerular filtration is common. Decreased renal blood flow, that is mainly due to decreased cardiac output. So we have already studied cardiovascular system. In that we have studied the cardiac functions also is been reducing, leading to decreased blood supply to the other organs. So decreased efficiency of kidney to concentrate the urine. So whatever the concentrate, high concentrate urine can be seen. So the amount of the waste particles will be high in that concentrate. So diminished kidney filtration rate and tubular function, so which cause decrease in the renal clearance of drug. So drug metabolisms, drug excretion is one of the major problems. So there will be drug accumulation in the body leading to ill effects of the drug. The decrease in the number of nephrons also has been seen. So that is about the genitourinary system. Okay, we will continue in this gastrointestinal system in next video.